Indeed, I want to say kudos to the leadership and the entire membership for your tireless effort in building the association in this part of the country. Indeed, Nurses and Midwives Week celebration is an important annual event that gives us the opportunity to celebrate our achievements and also to reflect on our contributions towards healthcare delivery. Mr. Chairman, ladies and gentlemen, I am greatly honored to give the keynote address under the theme Nurses and Midwives, a Voice to Lead, investing in nursing and respect nurses' rights to secure global health. In view of the exigencies of the time and the lessons that we have learned from COVID, you could not have chosen any better team than this. Indeed, the current situation is telling us a lot of things. COVID-19 has actually exposed the weaknesses and the vulnerabilities of our healthcare delivery system, as we have all seen and witnessed during the peak of the pandemic. And therefore, the team, Nurses and Midwives, a voice to lead, investing in nursing and respecting nurses' rights to secure global health, is most appropriate and timely. The weaknesses and the vulnerabilities that we all witnessed during the peak of the pandemic were clearly as a result of underinvestment in the healthcare delivery system around the world. The team, as we have said, focuses on the need to invest in nursing and respect the right of nurses and midwives in order to build resilient, high-quality health delivery system to meet the needs of individuals and communities now and into the future. The need for investment in healthcare sector has gained more prominence, most especially during the experiences of the COVID-19 pandemic. The team actually point out clearly, without ambiguity, that there is a linkage between investment in the nursing and midwifery workforce and global health security. The team demonstrates the need for us to invest in nursing and midwifery workforce to build a resilient, highly qualified nursing and midwifery workforce and to protect their rights in order to transform health system to meet the needs of individuals and communities. As far back as 2016, the United Nations highlighted the importance of adequate investment in nursing and midwifery workforce in order to support and promote public health and economic growth. Investment in nursing and midwifery workforce is critical in the promotion of patient safety. Yet, government over the years have largely resisted investing in nursing and midwifery workforce. I want to submit here that safe and high quality care would not and cannot be possible without significant and purposeful investment in nursing and midwifery workforce. Where are we asking or demanding for an investment in the nursing and midwifery? What is the justification? Somebody will ask. The evidence around us shows that highly skilled and qualified nurses and midwives are essential to ensuring the provision of high quality care. The nursing and midwifery professionals are well positioned to assume increasing responsibility for healthcare delivery. As we know, nurses are embedded in their communities and they influence health practices. This morning, on my way back, on my way from Hawaii to this place, I keep watching number of villages that I have passed and number of healthcare facilities. And the one question that keeps running through my mind as I observe is, apart from nurses and midwives, which other health professionals can we locate in those places? So nurses are found everywhere within the healthcare continuum. Places where other health professionals are conspicuously missing, you will find nurses there. Therefore, I dare to say that nurses and midwives are the backbone of healthcare delivery in Ghana and across the world. Without nurses, there is no healthcare delivery. Therefore, it's important that we invest in nursing and midwifery. Investing in them means that we are interested in restoring, transforming, and strengthening healthcare delivery system to ensure health equity. Nurses and midwives are invaluable human resource to any nation. We are regarded as the backbone of the health system, as I've already espoused. We are found in every part of the healthcare delivery system, providing critical services, including being patient counseling, educators, researchers, advocates throughout the system. Investing in nursing and midwifery is very important to accelerate progress towards achieving the SDG and the rhetoric about the achievement of universal health coverage. Are there dangers if we refuse or resist the temptation to invest? Yes. If we refuse to invest in nursing and midwifery adequately, Mr. Chair, there are some consequences that we are likely to face. COVID experience has already exposed us to what is the situation. There's a report recently published by Lancet in 2018 that shows that about 8.5 million deaths occur in the middle and low-income countries. And these deaths were as a result of healthcare lapses. And a significant number of those deaths were as a result of poor quality care. And poor quality care, eventually, is a result of underinvestment in the healthcare delivery. Are we going to continue this with losing our people to unavoidable deaths because of underinvestment? That is where we, as an association and as a profession, we are asking for more investment into nursing and midwifery in order to avoid needless and avoidable deaths. There are critical areas in our view we consider important for investment. So we talk about nursing and midwifery education, service delivery, working environment, and health and well-being of nurses. If we talk about our working environment, the least said about it, the better. I'm sure a greater number of us here are still living witnesses of whatever happens in our wards, in our workplaces, our offices. Look at your own chair you're sitting on, the tables you're working on, the walls, and all the things, the fittings. Does not give us that mental soundness to continue to work. And sometimes as a regional chairman, you are called on daily basis. We have this challenge, we are not safe here, we have this, and you have to be intervening. If adequate investment were made, we are sure that we'll have good working, service supportive environment to help us do a lot more to our patients. Service delivery is another important area that we need investments. Because of the underinvestment, one word that ran through nursing and midwifery practice right from school is improvisation. Constantly on daily basis, we are improvising. When we need simple medical equipment to make the work a lot more easier for us, they are totally absent. So at the end of the day, we have to improvise. So you see that nurses and midwives are always innovating in order to circumvent the serious challenges that come with things they need to provide quality service. In the 21st century, go back to our world and see the world setup. It's nothing to write home about. They're all deplorable. And you can see, particularly among the midwives, because of the poor working environment, some of them are having issues. The waist are twisted to, I don't know whether is it 180 degrees now? Yeah, these are all work hazards that we are exposed to. Then we'll talk about nursing and midwifery education. In recent time, we have seen that the government is making efforts to produce more nurses and midwives. We are having more admissions, but my dear brothers and sisters, there is more. We cannot focus only on numbers. We need the quality. If we compromise the quality, you and I stand to be a victim in the future. Because at one point or the other, we'll become patients and we'll need our colleagues to help us. In our nursing training and midwifery colleges, the numbers have been thrown out there. Even at the clinical area, we do not even have the facilities to support adequate skill acquisition for our graduates. And these are concerns. If quality care accounts for substantial, unavoidable deaths, I don't think it's proper for us to continue and look on without doing anything about it. And besides the training environment, even the faculty, the teachers, also need to be trained with the best teaching methods and approaches so that our graduates are worth their salt to deliver quality services to the patients. Another important area that needs investment is nursing jobs. Today, it saddens me to have listened to quite a number of our colleagues still fighting to be employed or posted. Whilst we have a huge shortfall of nurses and midwives at the clinical area. And as we speak, we have quite a number of highly skilled and experienced colleagues who are migrating to other parts of the world and making the precarious situation worse further. The situation is not getting better, it's getting worse. But we have trained nurses and midwives sitting at home. And the truth is that as you sit at home without practicing, the skill you acquired get deteriorated. And by the time you are coming back, you have to start afresh. And sadly, to say, these are people who come, who have to try and do error, and will end up killing a few lives before getting experience. It's a fact. So the better we wake up, the earlier we wake up, the better for all of us. One important thing that troubles us is nursing leadership. We know we form the bulk of the healthcare workforce. Nursing and midwifery workforce accounted for more than half of the global workforce, and in Ghana, nurses and midwives constitute about 60% of the health workforce. But despite our staggering number, we are woefully underrepresented in decision-making levels and policy-making levels of the healthcare delivery system. And it's time for us to do something about it. My suggestion to the new generation nurses is that it is time for us to be active participants in decision-making processes and policy formulation areas. Those days that we sit behind and wait for others to take decisions for us, to think for us, I think should be a thing of the past. Now we must be interested. There should not be the core meetings and you decide that you will not go. Those things should be a thing of the past. Every decision-making process, it is proper that nurses and midwives, our voices must be heard in those places. We should not sit aloof and wait for others to take decision for us. And lastly, another area that we think worth investing in for nurses and midwives is our health and well-being. We are the service deliverers, care providers. If you and I fall sick right now, if health insurance cannot cover you, you have to pay for everything from your pockets. And that, we think, is uncalled for. What kind of work is it that we are doing? And what's the benefit of the work we do? That when in the midst of, in the process of carrying out your duties, and you fall ill, you have to bear the costs of your treatment. And we think that something needs to be done about this. Even though we on our own have recognized this and have made some efforts to support our members by establishing a health fund, we think that our employer has a responsibility to do something better for us. it is interesting that nurses and midwives also have the right to practice in an environment that allows them to act in accordance with professional